Hi children. So today we can discuss another very important three disorders, namely first one is fragile X chromosome. Fragile X chromosome. You know what is X chromosome? Okay, X chromosome is present both in male as well as in female, but female having two X chromosomes. So fragile X chromosome is a peculiar pattern. It is caused by an expansion of CGG nucleotide repeats. You know what is nucleotides? And cytosine, guanine, guanine. So it is repeated in a particular pattern. It repeats number of times, and based on that the frequency of the disease. Okay. So this is happening in FMR1 gene at the end of a long arm of X chromosome. Okay. So the X chromosome long arm having a gene, namely FMR1 gene, and in that area that sequence, nucleotide sequence CGG repeats. That's actually fragile X chromosome. Okay. So what is the function of this gene FMR1? So FMR1 encodes an important protein, namely FMRP. What is FMRP? That is mainly this is for to regulate that mental health, I mean related to brain, mental retardation protein, mental fragile X mental retardation protein. Okay, and FMRP is an important for maintaining synaptic plasticity and ability to make new neurons. Okay, so this is when an abnormality or when a problem or mutation, that result will be severe, affecting nervous system. Okay. So approximately in male it is 1 in 3,600 or 4,000 birth, but in female it is 1 in 4,000 to 6,000 birth. Somewhat same, but usually females give this disease to the next generation. The three main fragile X disorders are prominent, discussed by medical science. One is full mutation. Full mutation is the very important one, that is a severe disease, and mutation up to repeat of CGG is 200 times repeats. Okay. So of the three types, first one is fragile X syndrome. Symptoms include intellectual disability, behavioral and learning challenges, and males are more frequently affected and generally with greater severity. So this is the fragile X syndrome, first one. And second one is that it is pronounced as FAXTAS, pronounced as FAXTAS, FXTAS, FAXTAS. Okay, FAXTAS, fragile X associated tremor or ataxia syndrome, FAXTAS. Okay, so what is actually this? Here this is pre-mutation carrier of FMR1 gene. Means that pre-mutation means repeats are not that much high, not 200 times or not that much high, and also patient having not no sign or no symptoms or very less symptoms. Okay, and usually it occur in male pre-mutation carrier after age with symptoms including balance, tremor, memory problems, etc. Okay, that is that FAXTAS. And another one is FAXPOI, fragile X associated primary ovarian insufficiency. Okay, so pre-mutation carrier of an FMR1 gene mutation have no sign of fragile X disorder, that I already told you. This is FAXPOI. It usually occur in females after the age of 40 it appears. Here also series of disorders in the ovarian function, that is a disorder. Okay, include infertility and early menopause, etc. Then how does FMR1 gene cause this fragile X syndrome? How this cause fragile X syndrome? Okay, see, FMR gene appears in four forms, and by the number of repeats of the pattern, CGG repeats. So four forms are there based on CGG repeats. Okay, so you know that adenine, thymine, cytosine, guanine. So CGG repeat in pattern of DNA that may repeat from 30 to 1000 times. So repeat may be 30 to 1000 times. Okay, based on the repeat there are different types. Okay, so that how you can see this first one. This is a normal X chromosome, FMR1 gene location here, and this is a mutated one, FMR1 gene. Okay, usually in the tip or telomeric part, somewhat that region having this problem. And normally individuals with less than 45 CGG repeats, that is normal FMR1 gene. The repeats I already told you, based on, there are 4 types. One is normal, the repeats is of CGG is between that 10 to like, okay. So here it is 45 CGG repeats, normal case, and intermediate case you can see 45 to 54 repeats, that is intermediate stage. This is gray zone allele, you can call it as, does not cause any disorder, intermediate. And next is the pre-mutation. What is pre-mutation? About 50 to 200 CGG repeats, 55 to 200 CGG repeats. It is actually an unstable, that means carry an unstable mutation of the gene. Unstable mutation of the gene can expand in future. In future it may express. Okay. So cause fragile X chromosome in their children or in their grandchildren. But at present it will not express because it's an unstable mutation with 55 to 200 repeats CGG. Clear? So first one normal case 45, second one up to 54, intermediate no problem, and third one pre-mutation. At the present condition it is usually unstable mutation, but in future the children or grandchildren may have the disease. Okay. Then full mutation. Full mutation is with more than 200 usually CGG repeats, and also causes fragile X syndrome. See, now from this you can clearly got the idea how this is arranged. Okay. So FMR1 gene, CGG repeats. So FMR1 gene produces an important protein, FMRP, I already told you. When the gene turned off, what happens is that protein never forms. Okay. So this lack of this protein results in the fragile X syndrome. Okay. So FMR gene mutated means protein not formed, result in syndrome. In male, usually what happens is male passes pre-mutation to his daughters, does not expand in full mutation. Usually that's happening in male, pre-mutation. Pre-mutation we thought that is a unstable stage. Okay. And a male never passes fragile X gene to his sons. Why? While a male never passes? Because from the male never passes to his son. Why? From the male, if a son want to born, what happens? Y chromosome is passing, not X. Okay. X from female and Y from male, that is son, son's XY. So a male never passes fragile X chromosome to his son. Okay. Since he passes only Y chromosome. Clear? So does not contain fragile X chromosome. What about a female condition? Females with FMR1 pre-mutation will passes to large version of mutation to her children. Pre-mutation or its unstable mutation can pass to the children. Also another 50% chance of passing these normal chromosomes and also FMR mutated chromosome. There are chances from females to their offsprings are very high in transferring this disease, this syndrome. Okay. So in families with the fragile X, among the general population and families, a number of CGG repeats ranges from 5 to 55 repeats. Family with this population. Okay. And among family with the fragile X, carriers having 55 to 200 copies. Carriers, that is usually pre-mutation. And among males and fragile X chromosome, number of repeats is exceeds 1000. That's a clear disease. So this image is about fragile X syndrome. Broad forehead, you can see broad forehead, then elongated face, large prominent ears, and also strabismus, crossed eyes, and highly arched palate are some of the syndrome, some of the disease symptoms of the syndrome. Medical condition. Serious health conditions occur due to this, like visual defect, seizure, ear infection, heart problems, etc. Then physical characteristic, I already told you, large ears, long face, flexible, highly flexible joints, etc. And how can you diagnose it? Usually diagnosis is done by testing amniotic fluid. Okay, amniocentesis you can see, and also by looking blood samples or tissue sample from inner cheek, or for detecting the presence of FMR1 gene on X chromosome. Then a DNA analysis technique like PCR technique, you know, and subsequent or later chromosomal studies to test whether this FMR gene is present or any mutation is there. Okay. Treatment is usually drug therapy is used, and also psychiatric medications or counseling is also required. Usually the patients will be under depression, so a proper counseling is required. See, so that's all about that Fragile X, okay, syndrome. Fragile X syndrome, very important. You have to study the genetic basis, very important genetic pattern, that is X chromosomes, and 4 kinds: normal, intermediate, pre-mutation and the full mutation. How it is happening, CGG repeats, and what are the patterns of repeats under each, and how what type of protein it encodes, and what is the subsequent results, and what are the symptoms. Okay. Now let us move on to another important disease, that is about an extra chromosome. You can see from the picture an extra chromosome, not like that of trisomy. This is an extra chromosome in the X, that is triple X syndrome. Triple X syndrome. So we discussed a Fragile X syndrome. Now we are moving to triple X syndrome. The term itself indicates triple. What do you mean by triple? Triple means 3. Okay. So triple X syndrome means disability of chromosomes that usually affect in 1 in 1000. Females usually. Female having the X chromosome, double combination triple X. This is happening maybe due to the formation of egg, any error in the formation of egg usually happening, and also the condition is genetic, but it never inherited, it's not inherited. Okay, a 3 X chromosome will be there. So see the pattern here, you can see 3 X chromosome instead of 2. That is the triple X syndrome. Very important and very easy to remember. This is first published the report by Patricia Jacob at Western General Hospital in Edinburgh, Scotland, and it was found in a lady, 35 years old lady, premature ovarian failure at age 19. So a detailed checkup revealed this triple X syndrome. Okay, symptom is mainly actually not cause any signs or symptoms. If they appear, it may be include tall stature, small head, and microcephaly we already discussed, and delayed development, motor skills, speech, language, and so on, kidney abnormalities, etc. like usual symptoms, but sometimes it never shows symptoms in the early stages. Okay, so usually you can see no usual physical features. See how these two child look like, very simple and very cute. So we can't say they have triple X syndromes. That is the condition. Okay. So it will appear later, but some abnormality will be there in the developmental pattern, and behavior and emotional difficulty will be there, taller than average, and some other changes, some unusual physical features you can observe in patients with the triple X syndrome. Okay. Treatment is based on the symptoms. Doctor will prescribe treatment, but counseling is a must. Okay. Psychological counseling is a must. So that's all about a triple X syndrome. Okay, so Fragile X and a triple X. Don't confuse with two. Fragile X is having an FMR1 gene and its mutation. Triple X is an addition, extra X, and inheritance is very less. Clear? Okay. Now one more and last syndrome, that is Wolf Hirschhorn Syndrome. It is a rare genetic disease. So rare genetic disease, so rare information only. In the chromosome number 4. So chromosome number 4 partly deleted. A portion of chromosome number 4 deleted. Okay, during the reproduction or any time. So very rare. 120 cases are reported in worldwide. Okay, usually in newborns. Sporadic in a majority of cases. 13% due to parental chromosomal aberrations. Okay. Genetic defects, I already told you, deletion of chromosome number 4. So what happens is some of the genetic material will be lost. It is required for full phenotypic expression, that is Wolf Hirschhorn syndrome. And new deletion of a region of chromosome 4p16 band, first time in the person with this syndrome. 40 to 45% cases unbalanced condition. Unbalanced translocation is the reason for this deletion. Okay. So a translocation unbalanced, how it become unbalanced? When a portion lost from a chromosome and it attaches to another chromosome, but from that a part never attaches to this chromosome. Okay. So if there are 2, 4 and 6, think chromosome number 4 and 6, part of chromosome number 4 cut and attaches to chromosome number 6. A part of chromosome number 6 cut and attaches to chromosome number 4. Balanced. That never happens. Here what happens is, from the chromosome number 4, a part deleted and stick on to some another chromosome. Okay, but that 4 is actually blank. The portion is blank, left blank. That is that happening in the case of unbalanced translocation. That may be the reason for this disease. Okay, WHS. And what are the symptoms, especially in the facial dysmorphic features that's happening related to our face. All the organs like head and neck, eyes, ears, mouth and oral structures are affected. So cranial symmetry, asymmetric condition, microcephaly, size small, ears deeply seated, malformed ears, eyes hyper telorism, means arched eyebrows, nose, beaked nose, wide bridge, etc. Mouth also having cup-shaped mouth, okay, cleft lip, so and so. So these are all the disease. And also eyes, can see coloboma in eyes. What is iris? Iris is an important part. So you can see a second pupil attached here, look like that, second pupil, or a black notch at the edge of pupil, okay, in that image that is given, second pupil or another one. And also a patient with the ptosis of both upper eyelids. So abnormal features in the eyes. The neurological problems like mental retardation, psychomotor retardation, weak cry in infancy, seizure, etc. These are all some of the neurological symptoms. Okay, so that's all for about WHS. Okay, so these are the diseases that you have to study. So in this class we discussed that X-linked, triple X, and also fragile X and WHS. Okay, so that's all for today's class. So have a nice day.